Hello, my name's David Drain, Specialist Youth Advisor with SHAYP, and in this SHAYP Talk I'm going to be spending a few minutes talking about the different family planning options available to people who are impacted by Huntington's disease. As you may know, Huntington's disease, or HD for short, is a hereditary disease, meaning that there is a chance that anyone who has it will pass it on when they have children. What this means is that people who have HD or are at risk of having it have more family planning options available to them than people who don't. So let's start by going through some of these options. An obvious place to begin is by talking about starting a family the most common and obvious way. In other words, becoming pregnant after having sex. It's important to remember that someone with HD has the same right to family life as everyone else. And so there's nothing to stop someone who either has HD or is at risk of having HD from having a family this way. But they may wish to consider that any child conceived naturally will also carry a risk of inheriting HD. Prenatal testing tells whether an unborn baby has inherited the HD gene or not. The test involves collecting some DNA from either the placenta or the amniotic fluid surrounding the baby, and usually takes place between the 11th and the 18th week of pregnancy. Once the results of the test come back, the parents will then need to make a decision about how to proceed with the pregnancy. It's worth noting that prenatal testing causes an increased risk of miscarriage, with an estimate of between 1 and 2% of pregnancies miscarrying after the procedure. Pre-implantation genetic testing, sometimes known as PGT or PGD for short, is a type of IVF treatment that potentially allows couples from HD families to have HD-free children. By combining female egg cells and male sperm cells, doctors are able to create human embryos which are then grown in a laboratory until some of these cells can be removed and then tested. The test result will tell whether the human embryo has inherited the gene that causes HD or not. If there are any HD-free embryos, then one is implanted into the woman's womb, and if successful, then 9 months later a baby is born. Other HD-free embryos can be frozen for using later. Embryos that are found to have the HD gene are either destroyed or sometimes used for research purposes. The chance of having a successful pregnancy using PGT is around 30%, and it can be a lengthy, physical and emotional process as it involves a lot of medication, appointments and procedures. Exclusion testing is used when someone who is at risk of HD wishes to find out whether their unborn baby or embryo has inherited the HD gene but does not want to be tested themselves. Exclusion testing works by comparing the DNA of the unborn baby or embryo, the at-risk parent and the HD affected grandparent, and indicates whether the baby or the embryo carries a high or a low risk of having inherited the HD gene. Exclusion testing can be complicated to understand, and so if you'd like to learn more, please do speak to your specialist youth advisor. Some other options to be aware of include fostering and adoption and egg and sperm donation. It's also worth mentioning that for some people, they may not wish to or are not able to have children. This could be a very personal choice. If you're actively seeking to avoid having children, then there are a range of contraceptive options available. You can speak to your GP or your local family planning centre for more information. Thank you for watching, and I'll end by sharing my top tips if you're thinking about starting a family. Learn as much as you can about the different options available. At SHAYP, we want to encourage you to come to a well thought through objective decision, taking into account the emotional, financial, moral, physical and lifestyle implications of your choice. Remember, it is okay to change your mind. How you feel about having children now might be very different to how you feel about it in the days, months and years ahead. Speak to your SHAYP Specialist Youth Advisor. Our job isn't to tell you what decision is right or wrong, but we will help by giving you trustworthy, accurate information which will help you weigh up your options. A good place to start is to read our HD Roots chapter called Having Children. The SHA have developed a world-first care framework for Huntington's disease, including a section on getting advice about having a family. You can check it out at care.hdscotland.org.
SHAYP would like to thank David for taking part in this SHAYP Talk. We hope you have found it useful. If you liked our video and want to help other people find it, then please like, comment below or share it with them. And we'll see you next time on SHAYP Talks.